Hello and welcome. Today we're diving deep into a fascinating and sometimes challenging condition, autoimmune pancreatitis, or AIP. We'll explore what it is, what causes it, how it affects the body, and what can be done about it. So, what exactly triggers autoimmune pancreatitis? As the name suggests, it's an autoimmune disorder. That means the body's immune system, which normally defends against foreign invaders like bacteria and viruses, mistakenly attacks the pancreas. The exact cause for this misdirected immune response isn't fully understood. Genetic predisposition, environmental factors, and even previous infections are all suspected to play a role. Research is ongoing to pinpoint the specific triggers that set off this autoimmune cascade. Let's break down what happens when the immune system targets the pancreas. The immune cells, primarily lymphocytes and plasma cells, infiltrate the pancreatic tissue. This infiltration leads to inflammation and swelling. Over time, this chronic inflammation can cause fibrosis, or scarring, of the pancreas. The scarring can disrupt the pancreas's ability to produce digestive enzymes and hormones like insulin, leading to digestive problems and potentially diabetes. Additionally, the inflammation can affect the bile ducts, leading to jaundice and other complications. Autoimmune pancreatitis is considered a relatively rare condition. It's more common in men than in women, and it's typically diagnosed in people between the ages of 50 and 70. While precise global statistics are still being gathered, APs thought account for a significant proportion of chronic pancreatitis cases, particularly in certain regions of the world. Ongoing research is aimed at better understanding the true prevalence and geographic distribution of this disease. The signs and symptoms of autoimmune pancreatitis can vary, and in some cases, the condition may be initially asymptomatic. However, common symptoms include painless jaundice, which is a yellowing of the skin and eyes. Patients may also experience abdominal pain, often mild and chronic, and weight loss. Some individuals may develop new-onset diabetes or have difficulty controlling existing diabetes. Other symptoms can include fatigue, malabsorption leading to greasy stools, and less commonly, nausea and vomiting. It's important to note that these symptoms can also be associated with other pancreatic conditions, making diagnosis challenging. Diagnosing autoimmune pancreatitis requires a combination of clinical evaluation, imaging studies, and laboratory tests. Imaging studies, such as CT scans, MRI, and endoscopic ultrasound, can reveal characteristic features of AIP, such as diffuse enlargement of the pancreas or narrowing of the bile duct. Blood tests are also crucial. Elevated levels of IgG4 antibodies, a specific type of immunoglobulin, are often found in AIP, although this isn't always present. A pancreatic biopsy, obtained through endoscopic ultrasound or other methods, can confirm the diagnosis by showing the characteristic immune cell infiltration and fibrosis. It is important to exclude other causes such as pancreatic cancer. Autoimmune pancreatitis is classified into two main types, type 1 and type 2. Type 1 AIP is also known as lymphoplasmacytic sclerosing pancreatitis or LPSP. It's characterized by G4-positive plasma cells infiltrating multiple organs, making it a systemic disease. Type 2 IP, also known as idiopathic duct-centric pancreatitis or IDCP, primarily affects the pancreas and is often associated with inflammatory bowel disease, particularly ulcerative colitis. The distinction between these types is important because it can influence treatment strategies and prognosis. The cornerstone of treatment for autoimmune pancreatitis is corticosteroids, such as prednisone. These medications help to suppress the immune system and reduce inflammation in the pancreas. Most patients experience significant improvement in their symptoms and pancreatic function with steroid therapy. However, steroids can have side effects, so the dosage is carefully tapered over time. For individuals who don't respond to steroids or who experience relapses, other immunosuppressant medications, such as azathioprine or rituximab, may be used. Management also includes addressing any complications, such as diabetes or bile duct obstruction. Pancreatic enzyme replacement therapy may be needed to help with digestion. Currently, there's no definitive way to prevent autoimmune pancreatitis. Because the exact causes are still being investigated, preventive strategies are limited. Maintaining a healthy lifestyle, avoiding smoking, and managing any underlying conditions like inflammatory bowel disease may be helpful. Early diagnosis and treatment are crucial to minimize long-term pancreatic damage. The prognosis for autoimmune pancreatitis is generally good, especially with prompt diagnosis and treatment. Most patients respond well to corticosteroid therapy and experience resolution of their symptoms and improved pancreatic function. However, relapses can occur, requiring further treatment. Long-term monitoring is essential to detect and manage any complications, such as diabetes or pancreatic insufficiency. Recent research focuses on identifying biomarkers to predict relapses and developing more targeted therapies with fewer side effects. Understanding the genetic and environmental factors that contribute to AIP remains a key area of investigation.